Good morning, everyone.
Good morning.
As of this morning, 707 people have died in Cook County from COVID-19. Of those, 355 were African American. This statistic is jarring, and it's a reminder of the crippling toll that structural racism and economic inequality have on our communities. I've always made racial equity a central focus of policy and practice for the county. It's been the basis of our 5-year policy roadmap. And by doing the work over the years, we know that crises like COVID-19 exacerbate the existing inequalities in our society. We're seeing that now with the widely disproportionate death rates from COVID-19 for African American and Latinx populations throughout the county. Early on, we realized that Black and brown communities would be the most vulnerable. That's why we put together a public map of each census tract with the Social Vulnerability Index. This index is calculated by using poverty statistics, lack of transportation access, language barriers, and other issues. When we look at the map on the Social Vulnerability Index, we will see that it corresponds to every other map, from life expectancy to gun violence. Communities across the south and west side of the county, communities of color, struggle the most. Early in our planning, Cook County developed COVID-19 responses and strategies to prioritize getting resources to those vulnerable communities and creating safety plans that would address some of these inequities. To even begin to address these inequities, we need to look at the data and use a data-driven approach. That's why this Social Vulnerability Index is so critical. In addition to that, I'm proud to announce that we've launched a new dashboard of data from the Medical Examiner's Office to present the public with clear, easy-to-understand information regarding COVID-19 deaths. The dashboard shows deaths by location, time, and most importantly for our focus today, race and ethnicity. 25 years ago, Cook County experienced a horrific heat wave, and over 700 people died in that disaster. Most of them were Black and brown. Most of them lived on the south and west sides of Cook County. Most of them lived in neighborhoods that suffered from decades of disinvestment, racist government policies, redlining, and over-policing. That's why we're taking a data-driven, equity-centered approach. We prioritize vulnerable communities when distributing donations of protective personal equipment and other emergency resources. We prioritize small minority-owned businesses and gig workers with our zero-interest loan fund as part of the Community Recovery Initiative. We provide multilingual technical assistance to help all businesses access forgivable loans through the Paycheck Protection Program, the federal program. We work with our community service providers to find emergency housing for those we have released from jail so that no one is homeless at this most dangerous time. Because for this crisis and the next crisis that hits, we can't repeat the same mistakes, whether it be the heat wave of 1995, Hurricane Katrina, or a global pandemic. We can't continue to allow our Black and brown communities to be hit the hardest by every single catastrophe. As we begin to look toward the light at the end of the tunnel, Cook County is using an equity lens, grounded in data, to make sure that our path to recovery is equitable and accessible to all of our residents, regardless of race, zip code, income, documentation status, because that is our moral responsibility, and it's our commitment to you. Now, I'd like to welcome Tom Lynch, our Chief Information Officer, Dr. Ponni Arunkumar, our Chief Medical Examiner, Dessa Gypalo, our Chief, did I do that right? Gypalo, our Chief Data Officer. And I'd like to thank Michael Albert and David Jones, our sign language interpreters. First, Tom Lynch, Chief Information Officer.
Thank you, Madam President. Good morning.
Good morning.
I'm Tom Lynch, Cook County's Chief Information Officer. I'm the head of Cook County Bureau of Technology. A pillar of the Bureau of Technology's mission is to create applications that provide transparency for the public and more generally open government. The Bureau of Technology is a support operation, therefore it's mostly behind the scenes. Most folks don't think about how their email makes it to their smartphone securely, but there's lots and lots of engineering work behind that to make that happen. We have many divisions who have worked very hard in this crisis to serve the public, from engineers running network lines to temporary shelters outside the hospitals, to technicians issuing laptops and secure network connections to thousands of Cook County employees to work remotely. But especially in times of crisis, enabling technologies which help connect government to the public we serve are most critical. Today, I'd like to focus on our divisions whose work most directly faces the public: Geographic Information Systems, also known as GIS, and data analytics. Technology is at its best when it's used to help connect people. Data analytics uses automated tools to help identify our most vulnerable populations, while GIS highlights where they are. Both tools are valuable in helping government to prioritize its resources to help protect those who need it the most. Data analytics and GIS harness the demographics of our county, the populations and municipal boundaries in which they reside, and apply analytical skills to help agencies direct those resources in a way that produces the greatest impact for our residents. As we see time and time again when examining the data, the impacts of natural disasters, economic downturns, and health crises do not fall equally on us all. Applying data science to geocoded data sets, we can see where those impacts are not equitably distributed and provide that data to county agencies, other government entities, nonprofits, and our residents to identify where help is needed most. In 2017, the Cook County Medical Examiner's Office and the Bureau of Technology teamed up to create a first-of-its-kind interactive dashboard, including maps and an open data set, providing public with a visualization of every medical examiner case since 2014. Those cases have been updated up to current, and in this time of crisis, we have teamed up yet again to provide a way for residents to see at a glance the lives lost to the COVID-19 pandemic and those disproportionate impacts on people of color in Cook County. While this dashboard won't directly show the impact the pandemic is having on families and communities across the county, it will help residents see the scale of the loss of life and to better understand the way the virus moves across the region. Now, to provide more context on the impact of the COVID-19 virus, I'd like to introduce Dr. Ponni Arunkumar, the Cook County's Chief Medical Examiner. Ponni?
Good morning. I want to begin by thanking President Preckwinkle. Your principal leadership is guiding me and my office as we work together as a team through the most challenging time of our careers in the county's medical examiner's office. I'm also grateful to Tom Lynch, Dessa, Gypalo, and the Bureau of Technology for working to make our data even more accessible to everyone. While the primary responsibility of my office is to determine the cause and manner of death for the decedents who fall under our jurisdiction, I believe we have a moral responsibility to do much more. Under President Preckwinkle's leadership, we have been challenged to look for ways to make a meaningful impact on our residents through our work. As the last physicians the patients under our care will ever have, we have privy to their medical history and to circumstances that have led to their deaths. Many times, those deaths could have been prevented either by enhanced access to health care or other intervention services. Our data shows that decedents who lived their lives in underserved and under-resourced communities have more comorbidities and lower life expectancies. Our data also shows us that communities of color are hardest hit. When it comes to the COVID-19 pandemic, these are the residents that are dying at the highest rate. In fact, although less than 23% of Cook County's residents are African American, they account for 50% of COVID-19 deaths. In the city of Chicago, African Americans make up 60% of COVID deaths. As this pandemic continues to take lives, it is our responsibility to share as much information about these victims and their environment as possible. Public health needs to know, policymakers need to know, the media needs to know because the residents need to know. That is why the Medical Examiner COVID-19 dashboard is so vital. We realized that we needed to enhance our ability to provide data specific to this pandemic so the people on the front lines of the fight against this virus can easily access information about where the deaths are occurring. This can help us identify clusters and surges and hopefully help us make the best decisions to save more lives. Ultimately, that's why my team of forensic pathologists works every day to determine the cause and manner of death of our patients. It is the hope that the information we uncover can be used by others, maybe even some of those who are watching this press conference right now, to make the changes in our community to extend the length and enhance the quality of life for every resident, regardless of their zip code. I hope everyone takes advantage of this new tool on our website. Knowledge is power, and in this case, knowledge has the power to save lives. Thank you. I now call Dessa Gypalo to give her remarks.
Good morning. Good morning. Thank you, Madam President, Tom, and Dr. Arunkumar. I'm Dessa Gypalo, Cook County's Chief Data Officer. The first application we are sharing today is the Cook County Social Vulnerability Index, or SVI map. It can be found at maps.cookcountyil.gov/SVI. Again, that's maps.cookcountyil.gov/SVI. The SVI map is an interactive way to share information with public health officials, policymakers, and members of the public about which communities in Cook County will likely need the most support before, during, and after a catastrophic event, such as a pandemic. Social vulnerability is a concept the U.S. Centers for Disease Control, or the CDC, uses to describe the susceptibility of a community to human suffering and financial loss in the event of a disaster. Factors that the CDC believes contribute to social vulnerability include poverty, lack of transportation access, language barriers, and others. The SVI is a measure of the presence of these combined factors in a community. And for more detailed information, please visit maps.cookcountyil.gov/SVI. The SVI score relies on U.S. Census Bureau data. Possible SVI scores range from 0, the lowest vulnerability, to 1, the highest vulnerability. The Cook County SVI map displays the SVI score for each census tract within the county. And very quickly, we're going to go through a walkthrough of the application. So here you can see that visitors may choose various boundary layers, including Chicago community area, Cook County border, or municipality contained within Cook County. As you zoom in, or you can the scores start to change, or you can manually select a grouping of census tracts based on one or an entire neighborhood or community area. All scores will then update based on your zoom level. So as you can see with this grouping of Cicero, that has an overall SVI score of 0.81, which is closer to 1, so it's a higher vulnerability area, and it has a population of around 83,000 people. Across the bottom, you can see that these scores are interactive and they do change based on the selection that is chosen, and we also have it in a Spanish version. So if we go to the, you also have this available in Spanish for those who are interested in drilling down. Real quick, the darker the shading of this, the more vulnerable the population. So you'll notice that there are different areas of color in here, and as it's closer to the yellow or white side, that is a lower vulnerability. As it gets darker blue, that's a higher vulnerability. And next, I would like to turn your attention to the Cook County Medical Examiner's COVID-19 dashboard. As mentioned earlier, this dashboard shows the striking difference in how the COVID-19 virus is affecting the different populations of Cook County. Our aim is to provide publicly available resources and tools like the COVID-19 dashboard and SVI map, so those architecting the response and recovery efforts of this pandemic can use a data-driven approach to their work. To visit the new Medical Examiner COVID-19 dashboard, please visit maps.cookcountyil.gov/medexamcovid19. Again, that's maps.cookcountyil.gov/medexamcovid19. And very quickly, I'll take you through a walkthrough of the various layers and filters that the GIS data analytics team and the medical examiners team have developed. First is that we have a cumulative COVID-19 related death count. As the president mentioned earlier, as of this morning, there are 707 COVID-related deaths. This data is updated twice a day, once at 6 a.m. and again at 4 p.m. We also have included demographic information, knowing that the most important breakdowns are looking at where vulnerable populations are being hit the worst. So on here you can see that we have race and ethnicity, gender and age, as well as other visualizations, including a density map based on the decedent's zip code, daily counts, and then a cumulative chart over time. This dashboard is interactive, and as you filter on the side where it says resident city, you can filter on various items, including date ranges, municipality, gender, and race. In addition to this dashboard, the team working on this has created a more comprehensive data explainer that has more robust definitions and explanations of how this data is sourced and what's contained therein. We urge you to visit both sites, and in the race ethnicity tab, there is a link directly to that explanation tab. Next week, we'll be rolling out a Spanish language version of the dashboard, and we expect to continually add information as it becomes available. We are committed to working with journalists, academics, and members of the public to continually improve our maps and open data. If your readers, listeners, or viewers have comments or suggestions, we encourage them to email our data team at open.data@cookcountyil.gov and let us know. One more time, that email address, open.data@cookcountyil.gov. Thank you. And with that, I'll turn it over to President Preckwinkle for questions.
All right, thank you very much to Tom Lynch, our Chief Information Officer, Dr. Ponni Arunkumar, our Chief Medical Examiner, and Dessa Gypalo. Did I say it right? Gypalo? Gypalo. Gypalo. Okay, Gypalo, thank you. Dessa Gypalo, Chief Data Officer. All right, questions?
Good morning, Alex Bacon from the Daily Line here.
All right, good morning, Alex.
I'll start just by, I'm wondering if there's anything in particular that anyone can speak to that they found really surprising in this new data, anything that really jumped out to them that they weren't expecting to see, or maybe that we have not seen in other information about, who's been affected here.
All right, Dessa, I'm going to ask you to answer the question. What jumped out at you? What was surprising?
Thank you for that question. So for me, what was surprising, what was exactly what was not surprising. We knew that by overlaying the social vulnerability index and looking at those areas that are most vulnerable, and then looking at resident address of the deceased, as you can see on our interactive map over there, they do match up fairly well, which is not shocking, and I think that was probably the most surprising thing, is that it validated some of our assumptions. Dr. Arunkumar, do you have anything else to add? Okay.
All right. Alex, do you have any other questions?
Just a couple off-topic questions, but I can wait on those.
Thank you. Is there anyone else on the line besides Alex?
Yeah, it's Joe Marr here with the Tribune. Can you guys hear
hear me okay?
I'm sorry, who is this?
That's Joe Marr with the Chicago Tribune.
Joe Marr.
Can you
Okay,
hear me
Joe.
okay?
Yes, we can hear you. Thank you.
Thank you so much. Hey, one technical question on the medical examiner data. I've got maps.cookcountyil.gov/medexam. Is there another backslash there, COVID-19? Or
All right.
is it just medexam?
All right, I'm going to ask Dr. Arunkumar to come forward and give you the information again. How can they access the information on the medical examiner's office?
So you would visit maps.cookcountyil.gov/medexam-COVID-19.
Could you do that again for us, Dr.
Okay,
Arunkumar?
gotcha.
Sure. That is maps.cookcountyil.gov/medexam-COVID-19.
Okay, gotcha. Okay, that makes sense. And the second question is, when we're looking at the social vulnerability index and we're looking at deaths, how much of a concern is it that there's an undercount that you're not seeing? In other words, cases that aren't going to the medical examiner's office that you can't chart.
Dr. Arunkumar, do you want to respond to that? The question is there an undercount?
Yes, I do believe there is an undercount, just like what happened in 1995 with the heat wave. When the incident was over, the CDC looked at all the deaths, the increased mortality, and determined a number of deaths due to the heat stress as higher than what the office had initially reported. So I think when this pandemic is done, by looking at that increased mortality, we'll get a better idea of the number of deaths due to the COVID-19 pandemic. Does that answer your question?
Yeah, it does. I'm just curious, though, with how the process works. Is your expectation there'll be some medical examiner cases the CDC might say, yeah, those were probably COVID? Or is it more likely to be cases that did not end up in your office
Can you repeat the
that are
question?
more likely to be undercount?
So the question was, would the increased number of deaths be cases that come under the medical examiner's jurisdiction or cases that did not come under the medical examiner's jurisdiction? I think it would be a combination of both, because the deaths that occur at homes that a physician has medical history for, or the patient has seen the physician recently, then the physician would be signing those death certificates. For those that are found at home with no treating physician, or those who have seen a physician more than 18 months ago, those are cases that come under our jurisdiction. So I think it would be a combination of both our office deaths and the non-medical examiner deaths, so the whole county's decedent data.
All right. Alex and Joe, is there anyone else on the line?
Hi, I'm on the line too. This is Rachel Hinton from the Sun-Times.
All right, we'll take Rachel next.
I have off-topic questions, so.
All right, let's, yeah, why don't we wait? Who else is on the line?
One more question, ma'am. This is Mariano Gilles with Univision Chicago. I was wondering if you were talking about higher cases in communities of color. I was wondering if you can talk specifically about the Latino community, which seems to have a lower amount of cases.
All right, so the question is, what do we know about the Latino community, and which our friends from Univision want to hear about in terms of the impact?
So the COVID-19 pandemic is affecting the Latino population as well. We follow the U.S. Census Bureau's classification for race. The Latino group is an ethnicity, so that information is given to the medical examiner's office by families. And with this pandemic, there is a delay in families taking care of disposition, so that data gets updated in this dashboard a little bit later. It could be up to weeks. So right now we have 49 Latino deaths so far, and you can see on the dashboard where these deaths are occurring to. But we'll get more up-to-date information for the Latino population a few weeks later, but it is affecting the Latino population, as you can see on the dashboard. Does that answer your question?
Yes, I was wondering if there's any explanation why, I mean, maybe that's the explanation why the impact seems to be lower than in the African American community. And I was wondering that the fact that a big amount of the population is undocumented had a relationship with it too.
All right, there's a two-part question. Why do we think there are fewer deaths in the Latino community than in the African American community? And what impact does the undocumented population have?
Right now, as seen on the dashboard, the African American population seems to be more affected by the pandemic. It is affecting the Latino population, but the exact number of Latino deaths will be updated in a few weeks. So currently, what is seeing on the dashboard will be updated about 2 to 3 weeks later when the families tell us about the ethnicity status. With regard to undocumented residents, we do not differentiate between whether they are documented or not. We get the information of the race, gender from notifiers like hospitals, and the ethnicity information from families. We do not ask for whether the decedents are documented or not. So that does not affect how we report our data.
Thank you.
Okay, so the short answer is the impact in terms of undocumented status is unknowable because that's not how we report data. All right, let's see. Rachel had an off-topic question. We got Alex and Joe and Univision. Who else are we missing?
Claudia Morel, WBZ. I just have a quick question.
Claudia, okay.
It's kind of related to this. Why does the county say that we are at the peak of cases now while the city says that we're still a ways off? And is this new data set kind of helping you determine, when the peak will hit, or if we're in the middle of the peak right now?
All right. I think that's a public health question. We don't have any public health staff people here, so we'll have to get back to you. And that was Claudia. Is that right, Claudia?
Yeah, Claudia.
All right, Claudia from WBEZ. We'll have one of our communications people get back to you. The staff here is not able to answer the question.
Okay.
All right.
That was it. That was my only question.
All right. Thank you, Claudia. All right. So let's go back. Alex, do you have any other questions on topic?
On topic, no.
Joe, do you have any other questions on topic?
No, not on topic.
Marino, is that, did I say, who's from Univision?
Mariano, ma'am, thank you very much. And no, I don't have any other questions.
All right. I mispronounced your name. My apologies, friend. All right. And who was last here? Claudia doesn't have any. She does a question, and we're going to get back to her. Okay. All right. Off-topic questions.
What are your thoughts on the proceedings yesterday to pick former Commissioner Tobolski's replacement?
My understanding, the question is, what are my thoughts on the proceedings yesterday to pick a replacement for former Commissioner Tobolski? So, first of all, I was not in attendance. And secondly, I got a report late in the evening that Frank Aguilar, I believe that's how you pronounce his last name, was chosen to replace Commissioner Tobolski. I don't know Frank Aguilar, and I haven't spoken with him, so I will call him to congratulate him later today.
There were protesters outside of the meeting protesting his potential appointment before, this decision was made. I guess what message do you think this pick sends to the constituents of that district who fear that he won't represent them correctly or appropriately, and that he has his own issues with corruption, maybe not to the level that former Commissioner Tobolski might have, but it's still questionable?
As I said, Rachel, I don't know anything about this person. And so I can't really comment either on him or his suitability for the job or people who were protesting his potential appointment.
Thank you.
Can I just follow up on this as Alex at the Daily Line and ask if you think it was appropriate this meeting was done entirely behind closed doors, that they didn't even announce the winner afterward? I mean, as far as I know, we still haven't gotten any official announcement until, you know, what you just said just now.
So let me just say, I'm not a member of the committee that made this choice. I wasn't present. I don't know anything about the proceedings.
My question was, I mean, do you think it was appropriate for that to be done entirely in private and for not to be announced afterward?
I'm not sure who the chair of the committee was, nor actually the members. I don't know which Democratic committeemen share part of Commissioner Tobolsky's district. And I would suggest that you talk to somebody who was present and who was involved in the proceedings about the choices they made.
Can I follow up on that?
And you are, who is this, Rachel?
again? Yes, this is Rachel.
Yes?
The committee members who were present, Mr. Aguilar is a Republican or has been a Republican. He voted Republican in the past. When he was elected as state rep, he was a Republican. What are your thoughts on picking someone with Republican ties for this seat?
I think I'll decline to comment on that. I'm a Democrat.
What do you think this says about the party? Yesterday you talked about party loyalty, you know, and picking or going with slated candidates. Do you think that this poses an issue for loyalty to the party or creates other issues down the line for your role as chair?
You know, this was a committee of the Central Committee. Those who participated had constituents within the district. You know, I would refer you to people who were present and who participated, which I didn't. Are there any further on-topic questions? All right, thank you all for joining us. Grateful.
Can I ask a very quick question to Tom Lynch?
Who's
If you
this,
have
Alex
a
again?
moment. This is Alex.
All right.
Just in response to the OIIG report that was published yesterday that described a cybersecurity breach against, I think, Cook County Health payroll system that recommended the Bureau of Technology adopt a few new cybersecurity measures. I'm wondering if you could speak to that at all, whether those.
All right, so Tom Lynch, this
recommendations
is
are
a question.
appropriate.
This is a question about a report, frankly, of which I'm unaware, from our Inspector General, which talks about a breach of Cook County Health payroll system. Are you know anything about that? I do. All right, Tom Lynch, our Chief Information Officer.
Thank you for the question. As laid out in fair detail in the report, this is an incident of cyber fraud where a small number of employees had their credentials taken to change their deposit information for their direct deposit accounts, where the dollars were essentially resent to a different account and then turned into cash cards, a clear case of cyber fraud. The report speaks to the details, so I won't belabor them. What I will say is that both the Bureau of Technology and the Cook County Health and Hospital System worked very closely together, both for the application layer security as well as the cyber security. And we have adopted most of the recommendations that were made in the report. In fact, earlier this morning for the offices under the President, we have rolled out two-factor authentication for our network authentication. responding to the recommendations made by the Inspector General.
Thank you.
All right, are there any further questions?
Yeah, Joe, it's a Tribune, which is, I'll give you maybe a half on topic question. I'm not sure how we define it here. But this is, you guys have a lot of open data here. And I don't know of another county who's doing this in the state. And certainly the state itself isn't releasing the kind of level of data that you guys are. Have you got any pushback from the state? Do you think other counties should be releasing more of this data so people elsewhere beyond Cook County can look into the specifics of where these cases are happening?
All right, so Tom, the question is, we're releasing more data than other counties in the state or the state itself. Does that present any challenges?
So, of course, those jurisdictions have control and autonomy about the decisions for what they choose to share publicly. But I think it's fair to say that we are encouraging all of our partners, the state, other counties, and the city of Chicago, to collaborate as much as possible so that the data that's available is comprehensive across all jurisdictional boundaries. Dessa has been in frequent communication with counties of DuPage and Lake, as well as the state of Illinois and the city of Chicago, as I noted. And while of course, it's their decision as to how and what they decide to post publicly, I can definitely say that there is quite a bit of discussion and cross-collaboration across those entities.